What is control group? As just sit on the mat and the machine is not on. So you don't know that. Yeah, so this is for control. This without treatment and the other group with treatment. After 36 weeks, then in the treatment group, the hair count increase around 66%. With the other group, no significant increase. And so this can show really the treatment is effective, right? And another study is also about the hair loss, but this is not for treatment. This is for prevention. As the women and the chemotherapy, so breast cancer and the chemotherapy, we know that it's well known with chemotherapy, this will result in hair loss. Right? So just with this treatment to test its effect on prevention of hair loss. And you find this in how many people here in the study? It's it's 19, so 13 participants, 13 women, and 12 effectively prevention of hair loss. Actually, after chemotherapy, it's 100% hair loss. But 12 effectively prevention of hair loss, only one. So this show you its effectiveness. It's effective, but not 100%. 12 of 13 effective, but one no response. But this we consider it is effective because when you get a patient, you can tell the patient so the potential of this treatment is not 100%, but it is more than 90% chance for prevention of the hair loss, right? And here just photos show this is a result as 9 months. This one, 9 months after the treatment, and this 2 months. Any difference? Yeah, from figure, and you can also count the density. Usually we assess this not qualitatively. Here show you the picture on the qualitatively. If we report it as with quantitative evaluation, then just for example, select this area and then we measure the density, how many hairs there, count the number. And this one, yeah, and the difference, also 2 months. Okay, so another indication is a headache. And this study is using actually the headache. We cannot direct measure headache, right? The severity of headache. Then can only ask the patient with questionnaire. Then the questionnaire to ask the patient to find here 25 subjects. And effective, from here, effective with good effect or perfect cure. As only 4. So no effect, and 21 effective or good effect or perfect cure. So this is why use a group to test, because the response actually they can to different level, different extent. So all effective, but with good effect, a perfect cure, or just decreased pain. This is another study on the oxygen saturation. Perhaps this can explain why this can treat many different types of disease. Actually, the disease like some like the hair loss, like headache, all that's related to the oxygen situation of the tissue, of different type of tissue. Right. And this study just show you the oxygen situation before and after the treatment. Okay, read the level at the end of this table. This is 46,000, right? And this 64,000. This is an average measurement of a group of people. It's not from a single subject. It's from a group of people and calculate the average. So the average in this group, see here, is 46,000, and this is 64,000. It's a big difference, right? Yeah. So the oxygen situation is actually improved by using this eLife. Although you don't feel anything, any stimulation, but it can really change the oxygen situation. So when it can change improve the blood circulation, can change the tissue oxygen situation. Then for the wound healing, so when there's a wound, it's an injury, the skin, there's a wound, the healing is through first the blood vessel goes into the wound, and then there's blood restoration of the blood circulation, and then the healing of the wound, right? So have you met any diabetic patient? So diabetic patient, they have problem in their blood tissue, blood vessel, and when they get any injury like this one, it's black, this wound, right? Because the black is because there is no blood vessel there, the died of the tissue, and usually without treatment, there is no healing of this wound. This is with eLife. So see gradually the healing of the tissue. So for people without diabetes, the wound healing is within several weeks only. But for diabetic patients, it can last very long time. There is no healing. And endly, there is amputation of the leg. So now if you meet any patient with amputation, actually 50% of them is because just caused by such a small wound, and then further infection to the whole limb, and then amputation. So 50% amputee are diabetic patients, and the other 50% traumatic. This is another, as also, actually it's a small wound and an injury, but because this is a diabetic patient, without treatment, there is no healing, and then amputation of this limb. But this, with treatment, you see gradually there's new tissue, and the color change. This is white, right? Lack of blood supply, and here, red, as ingrowth of the blood vessel. When there is new blood vessel, there is blood supply. Gradually, there is healing of this wound. But this is because there's improved blood circulation and also improved oxygenation of the tissue. And this is another case. So this study is conducted in Europe. So for diabetic foot, it is effective, as shown by this study. There is a healing of the injury, and patient, there is a decreased pain, and also evidence by the decreased use of painkiller in patients. Okay. Now with these cases, at least you can see for hair loss, for headache, for the diabetic foot. So all this related to the blood supply, the disease is quite effective, right?